get government out of the insurance business. We've already shown that they're not that good at estimating costs. When Congress has a 13% approval rating, why in the world do we want them running our health care? Really? So let's get the government out of the insurance business. Let's have health savings accounts for Medicare and Medicaid. There are some states that have Medicaid accounts that have the Medicaid patients and enrollees have a little health savings account so they get to manage their own money. And if they use the money wisely and if they get off of Medicaid and haven't used up that money, they get to keep it, whatever's left, to help them get started on their own with their health savings account. These are great programs and they save money. They don't cost more money, they save money. Get Medicare the same way. The elderly are just as good at shopping as the rest of us. You can have people that can help them out. They don't have to be on their own. There will be services that will pop up all over the place to help people shop for health care, right? You'll have an iPhone app in a heartbeat that's going to say, oh, this is the price for CT scans of the abdomen and pelvis with, blah, 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 all over town. And this is the one closest to you, and this is what they're going to charge this week, right? So this is going to be real easy for us to manage, folks. You spend more time looking for a big screen television than you do picking out your health savings account. I did. I admit it. So what we want is people to get a little more invested in their health care. Now, if the government gets out of the health care business, this will allow for real control of health care costs without rationing of care and limiting reimbursement to providers. Put it in a competitive marketplace. That's how you save money. This is also going to eliminate unnecessary regulation that we've already talked about, increases healthcare costs by up to 40%. Eliminate state insurance mandates, or at least decrease them markedly. Some states have lists of like 74 different mandates that they require for every health insurance policy. All that means is that I'm paying for things that I'm not going to use in order to help pay for something that someone else is going to use. That's just another form of subsidy, right? So let's have, in order to make these policies affordable, let me pick what coverage I want. I may be willing to pay cash for a lot of things or take a chance that I'm going to have, abuse problems, substance abuse problems or something, and that I'll pay for those out of pocket, right? But I don't want to pay for premiums to cover that for years and years and years.
It's interesting she talks about mandates, because years ago I saw a list of New York's mandates. It was in the Wall Street Journal. So every group goes to the politicians. So maybe you do acupuncture and you go make some nice donations, and now there's acupuncture. And then there's the foot doctor, and then there's massage. And that's one of the reasons it's so expensive, because they go to the politicians, and can you imagine seeing a list of 94 mandates that maybe you don't want acupuncture? That's what I think she's trying to get at.
And never use it. So let's let people make their own choices about what coverage they have, and that way they're going to be more likely to have a policy and pay the premiums if they have a choice about how to adjust those premiums and keep them affordable. Tort reform. So we think that there should be panels of judges, say expert physicians and lawyers, that review cases before they go into arbitration, and certainly before they go into court. So that these groups, these panels, would review a case and find if it's a bona fide case, great. Send it on its way. Let's get payment and reimbursement to the person who's been injured. Absolutely. If it's a frivolous lawsuit, then it doesn't go any further. Any court costs incurred up to that point by the people involved in the case need to be paid by the plaintiff and the plaintiff's lawyer, especially the plaintiff's lawyer, because obviously the plaintiff isn't necessarily going to know it's a frivolous lawsuit. The lawyer should know.
This is a big deal to obstetricians. Every other country has what's called loser pays, or the English system. And that stops all the frivolous suits. Now, the lawyers don't want to do that here, and most of our legislators are lawyers. But it's killing the doctors. The average obstetrician, anyone want to guess how many suits the average obstetrician has? 3. I mean, I know people that have had 6, can't even get insurance. Cerebral palsy is such a sad, sad thing. It's 2 babies per 1,000. The government did a massive study and said that only 3 to 6% of cerebral palsy happens in the labor and delivery room, but the doctor will always lose. About 1/3 of it's prematurity, probably about 2/3 of it's an infection that gets in, and the baby's brain makes these cytokines to fight the infection, and that probably causes, we think, the cerebral palsy. So it might have happened 2 or 3 months ago, and we can prove that on MRI, CAT scan, and ultrasound. Doctor will lose every case. Just bring the kid in. So we only have about $1 million of insurance. It was a $38 million suit up in Hartford. So really, the doctor probably saves 400 or 500 lives and really can't own their own home in America. When I started dating Sue, we weren't even married. I went to a bankruptcy lawyer, said, what should I do? She said, give everything to her. So then, of course, the woman runs off with her boyfriend, and you're out of luck. But it's just a terrible thing, because here you save so many lives. I mean, medicine is so rewarding, but you really can't own your home in America. I just think that's so sad. I was thinking of a case one night, it was the middle of the night, there's a lady from Haiti, I'm sure she was a legal immigrant, but had 3 little girls. She has a ruptured tubal pregnancy. She's lost about 2/3 of her blood, and she probably has about 20 more minutes to live. But the littlest girl was Down syndrome. And she's crying because she doesn't know what's going on, but she's convinced she'll never see mom again. And I gotta tell you, to go in and save her life and give the mother, who was about 26, you know, another 60 years of life, and to give that little girl her mother back, because I don't think there's anything like mother's love. I can't tell you how rewarding medicine is, but it's just not worth it when you add up the government and the lawyers and the lack of money that you get. I mean, I trained 14 years after Norwalk High School. Night, weekends, holidays, Christmas, summers. I just think it's gotten to be too much, you know what I mean?
So that's what we want to do. We want to stop the frivolous lawsuits. We want to stop the lawsuits that are filed in spite of the physician and providers doing everything right. So let's talk about what these changes will do. It's going to decrease premium prices significantly. It's going to allow for patients with pre-existing conditions to get coverage and services. It's going to decrease overall healthcare costs. It's going to allow for competition in the marketplace. It's going to allow for transparency in healthcare costs, and it puts decision-making in the hands of the patients where it belongs. The best thing these changes will do is preserve our freedom as Americans.
The other night, and during the debate, Governor Romney was talking about poor inner city kids, and what he wanted to do is to give them, let's say that town spends $12,000. I know Brookfield's $13,600 we spend per kid. Give it to the kid, and the mother now, maybe in inner city DC, can go and let all the schools compete for her child, and then maybe they can go to Sidwell Friends School like Clinton's and like Obama's daughters went to. I think that's what she's trying to say. Let's say your Medicare is $13,000 a year. We give you the 13, or a voucher for it, and trust me, every HMO is going to compete. Well, we're going to give you free glasses and we'll give you massages. I think that's what she's saying is the solution. To just give you the voucher, and it empowers you, and you can go anywhere with it. That's what Congress does for itself. They get the money, and there's at least 4 or 5 HMOs competing for them. But of course, I think we ought to throw Congress into the same thing we do too, same for their pensions.
Exactly.
But they don't seem to agree with that. By the way, it's interesting now, Sue's son's brother-in-law has $129,000 of student debt from a psych degree at Amherst, okay? Hasn't worked much in the last 3 years. $1,400 a month for a student loan. I just saw the other day, if you're a congressional staffer or spouse, you don't have to pay your loans. That was nice.